Hello friends, welcome back to Dr. Jaggi's Academy. So in today's video, I will discuss about the therapeutic uses of anticholinergic agents. I hope you must have seen my previous video on the anticholinergic agents. So the link of that is given in this video also. So before going to this video, please watch the video of the anticholinergic agents, okay? Because that is forming the basis. If only you know the basics of anticholinergics, then you are able to understand the today's video. So let's start. In this video, first I will discuss the uses of anticholinergic agents and I will discuss what are the drugs which are given in different kind of diseases, and then at the end I will discuss the classification of anticholinergic agents. So first of all, going to the uses of anticholinergic agents. So first of all, I will discuss the use in the motion sickness. What is motion sickness? Motion means movement. Sickness means when person is not feeling well. Well, in terms of this is a very common problem when the person goes for a traveling, like in a car, in a bus, particularly in the hilly areas. Okay, so because of the movement, there are many persons who start feeling nauseated and vomiting starts. So that condition is called as motion sickness. So in the previous video related to anticholinergic agents, okay, so I discussed that there is a role of the cholinergic system. So we can give the drug anticholinergic agents, particularly the drug that we use is the hyoscine. It can be given orally, and particularly it has to be given at least 30 minutes before the traveling, because once the vomiting start, then these drugs, they are not effective. So should be given at least 30 minutes before the travel time. Second drug is the promethazine. Okay, which can also be taken in the form of a tablet. Now promethazine is actually a antihistaminic agent. It blocks H1 receptors, but along with antihistaminic activity, it is having additional anticholinergic actions. Okay, so it has dual activity, antihistaminic and anticholinergic agents, and it is a very, very effective drug. And the trade name of this promethazine is the Avomine, which is very effective in reducing the vomiting. Third, we can use the dicyclomine. It is again an anticholinergic agent which can also be used. But obviously, as I told, the anticholinergics are having certain side effects like dryness, then sedation. It is important that person should not go for a driving itself, because it can produce certain sedation which can be problematic. So this is an important use in the motion sickness which is related to the CNS. Second use, again related to the CNS, that is anti-Parkinsonism. So you remember that in the Parkinsonism there is an imbalance between the acetylcholine and dopamine. The levels of acetylcholine, they are increased. So we give centrally acting anticholinergic drugs. What is the meaning of centrally acting? That means we are giving those anticholinergic agents who act preferentially in the CNS. That means they are having more tendency to act in the CNS in comparison to the peripheral effect. So what are those drugs? One drug is trihexyphenidyl, then procyclidine, and then biperidine. These are some of the drugs which can be given in the Parkinsonism. Now I will discuss about the status, that is where these drugs stand when you compare all the anti-Parkinsonian drugs. So L-Dopa, levodopa, is obviously, it is the drug of choice in the Parkinsonism. So obviously these drugs are not that effective in comparison to L-Dopa. So that means these are less effective. But these can be given in the initial therapy, in the initial stages of Parkinsonism, or in the late stages of Parkinsonism. Then you can combine with L-Dopa like drugs. Okay, so these drugs are having preferential effect on the, you can say, on the tremors. They control the tremors to a very good extent. Okay, so this is the second central use of anticholinergic agents, that is anti-Parkinsonian drugs. Now coming down to the cardiac uses. Again I am telling, before going into details of this video, watch the video of anticholinergic agents, the link of which is given in this video also, in the discussion section. So now cardiac uses. So these anticholinergic agents, they are they can be used to overcome bradycardia. Bradycardia means slow heart rate, or heart block, which is can be to the AV blockade, because the conduction is not flowing from the atria to the ventricles. So because in between some blockade has taken place. So these kind of things can be found if the person is suffering from myocardial infarction, that is a heart attack, ischemic heart disease, or if there is certain toxicity of a drug like digitalis. In these conditions, in these things, bradycardia or heart block is there, so we can give atropine sulfate either intravenously or intramuscularly. So it will normalize the heart rate, it will increase the conduction velocity. So very important use of these drug in these conditions. So cardiac uses. Now, as a mydriatic and cycloplegic agent. So I will discuss these mydriatic and cycloplegic under two headings. First, I am discussing the diagnostic agents. Diagnosis means you want to diagnose certain thing in the eye. Okay. So first is the fundoscopy. What is the fundoscopy? Fundoscopy, what the doctor do is that he want to see inside your eye. Okay, inside the eye means he want to visualize the retina. Okay, or the optic nerve. So how he can visualize the eye? So he will use the magnifying glass, he will use a light, but obviously the things can be seen if the eyes are open, they are dilated, mydriasis is there. Okay, so before performing fundoscopy, he want to dilate the eyes, so mydriasis has to be there. Then refraction testing, eye testing for the vision testing. Again, a doctor want to see your eye. So in these conditions, we need a fast acting plus short acting anticholinergics, which are given in the form of eye drops. So remember, whenever we are using a diagnostic, we always need a short acting drugs, not the long acting drugs. So what can be the drugs? Tropicamide, cyclopentolate, or home atropine. So these drugs are very effective. These are particularly having a very short half-life, like tropicamide drugs. Okay, so I will discuss this point, fast-acting and short-acting actions of these in the next slide. So again I am discussing why we are using tropicamide and cyclopentolate for the diagnosis of eye disorders. So now, let's say we are not using a short-acting anticholinergic, but we are using a long-acting anticholinergic, particularly for the refraction testing or the fundoscopy, that means for the diagnosis. Now, if you will put the anticholinergic into the eye in the form of eye drop, even if the diagnosis is over, okay, even then these side effects related to the eye will remain, because drug action they will remain for a long period of time. What are the side effects? Now, as you remember, the major side effect is the photophobia because of the mydriasis, because of the cycloplegia, because ciliary muscles are relaxed. There's you cannot see the far objects. You cannot see the near objects. So there is a blurring of the near visions. So these are the two side effects that will remain, that will persist if you are using a long-acting anticholinergic agents. But if you are using tropicamide or cyclopentolate, which are short-acting drugs, so these side effects will not there. So this cross indicates these side effects will not persist. So effects do not last for a longer period of time. So that is why these agents are preferred in the eye diagnosis. Okay. So now coming to the second thing, as a mydriatic and cycloplegic. Now these can be used as the therapeutic agents. We discussed the diagnosis. Now these can be used as a therapeutic disorder. That means there is some disease, then you can use these drugs. Like if there is a severe pain or there is a spasm. So when we can say there is a pain in the eyes and spasm, what are those conditions? I'm discussing these things. Like iritis, that is inflammation of eye. Okay, so why there is a pain and spasm and how these can be used? Because here the cycloplegic action is coming into play, because they are relaxing the ciliary muscles. If the ciliary muscles are relaxed, so tension is not there, spasm is not there. So muscles are relaxed, so pain is relieved. So number of inflammatory conditions like inflammation of the iris, inflammation of the cornea, which is called as keratitis, corneal ulcer, or choroiditis, that is inflammation of choroid. These are the painful conditions, so you can use the cycloplegic actions. Now, if the iris or lens or the cornea, they are attached to one another. Okay, so what you can do, you can use the miotic and mydriatic alternatively. That means add miotic, then after certain period of time add mydriatic. Meiosis, mydriatic. So this kind of alternate contraction and relaxation, meiosis and mydriasis, will break down the contact, if any contact is there between the iris and the lens or with the cornea. So these are the two important uses where the mydriatic and cycloplegic actions of anticholinergic, they come into play. So the drug that we can give in the form of eye drop in this condition is a long-acting drug, that is atropine. Coming down to the next one, respiratory diseases. So anticholinergics are bronchodilators. They dilate the bronchi. So where these can be useful? These can be useful in the bronchial asthma. These can also be useful in the COPD. COPD refers to chronic obstructive pulmonary disorder. In COPD, there are two disorders. One is chronic bronchitis and second is emphysema. I'm not discussing COPD in detail. I will discuss in my pathophysiology. Here I am just mentioning asthma and COPD. So now if you compare these two diseases and you take your anticholinergic agent, so anticholinergic agents, they are more useful in COPD in comparison to asthma. Reason? Because if you study the pathophysiology of asthma or COPD, there is greater involvement of parasympathetic nervous system in COPD than in asthma. So obviously, you can say anticholinergics will be more effective in COPD. So what are the preferred drugs in asthma? In the asthma, the preferred drugs are beta-2 agonists, which are the adrenergic drugs. So example of adrenergic drugs or beta-2 agonist is the salbutamol. It is the preferred drug. Not anticholinergics, but if we are giving anticholinergics, what are those anticholinergics? One is ipratropium bromide. It is to be given by inhalational route. It has to be inhaled. Okay, in the microgram doses. It can be given in 3 to 4 times a day. Then there is a tiotropium bromide, which is a longer acting drug than the ipratropium. So it can be given once a day. Longer acting, even dose is less. So now if you study these two drugs, they are having the gradual onset. That means if you inhale this drug, the effect will not appear immediately. It will take certain period of time, 4 or 6 hours. So obviously these cannot be used for the rapid symptomatic relief, not for rapid symptomatic relief, but these are effective as a prophylactic uses. That means attack can be prevented. Then we are using instead of symptomatic relief. So now I am discussing why ipratropium bromide, not other anticholinergic agents. That means ipratropium bromide or tiotropium, both I am considering here. So let's say if we are using anticholinergics other than ipratropium. So if these anticholinergics are inhaled, then after inhalation, these anticholinergics will be absorbed from the respiratory tract. And after absorption, they will produce the systemic side effects. Okay. Plus, when they are inhaled, they will depress. What will be depressed? They will reduce the bronchial secretions. They will depress the mucociliary clearance. If you remember, in the bronchi there are cilia. So the cilia, they beat continuously so that whatever the bacteria is coming inside, it is moved outside. Plus there are secretions. So this kind of a mechanism is a protective mechanism. But if this protective mechanism is lost, so there is a formation of dry mucosal plug, and this dry mucosal plug is a source of infection in the respiratory tract. So these are the disadvantages of anticholinergic agents. But if we give ipratropium bromide, which is actually a quaternary nitrogen compound, because it is quaternary nitrogen compound, it is not absorbed. If it is not absorbed from the respiratory tract, it remains in the respiratory tract. So it produces the local action. As a result, systemic side effects are not there. So this is one thing, one advantage of ipratropium bromide, no systemic side effect. Second thing, ipratropium bromide has minimal effect on this system. No effect on this system. So if it is having no effect, obviously it is not having any effect on the infections. That means no infection which is actually there with the other anticholinergic agents. So these are the two advantages because of that we give in the asthma or in COPD. So now another use of anticholinergic agents, they are used as antispasmodic agents. As spasm means contraction, intense contraction of the smooth muscles. So now this is a very broad word, antispasmodic. So in this category I will discuss number of diseases. Okay, so you see first the name of the diseases. First is I'm discussing the irritable bowel syndrome. Irritable, something is irritating. Bowel means large intestine. So the person is not having large intestine, is not functional. Okay, you can say not fully functional, some problem is always there. So what kind of symptoms is there? In the short, irritable bowel syndrome is called as IBS. So there is a problem of large intestine, there is a cramp, this abdominal pain, bloating, something gas is being produced. There can be diarrhea or constipation. So these kind of irritable bowel syndrome is there, in which contraction, abdominal contraction is an important factor. Then intestinal colic. What is the meaning of this colic? Colic means a sudden intense pain which can come at any time, and ultimately it can slow down also. Okay, so intestine, so something has contracted in the intestine, abdominal cramps and pain, very painful condition, intestinal colic. Then there can be a renal colic. Renal colic means there is some kidney stone, there is an intense pain in the kidney region. Then pylorospasm, contraction of the pylorus. Pylorus, you remember, it is the last portion of the, you can say the pylorus portion of the stomach. So that is contracted. So this is also producing the pain. Then nervous dyspepsia. Nervous means something related to the emotions or mental status. Dyspepsia, indigestion. So because person is under stress, okay, so because of that emotional problems, the digestion system becomes weak. So this is called as dyspepsia. So in all these conditions, if you give anticholinergic agents, so you get a symptomatic relief, because the contraction, the spasm in the alimentary tract is overcome by these anticholinergic agents. So what are the drugs which are given? So we give quaternary nitrogen compounds like clidinium, semitropium bromide, isopropamide. We can also give the tertiary amines like dicyclomine, like vilethamate. So these are the antispasmodic agents. So I am continuing antispasmodic agents in the next slide also. It can be used in the biliary colic, pain in the gallbladder region, but atropine-like drugs, anticholinergic agents, they are not very effective, they are less effective. So what is effective? Nitrates, they are more effective. Nitrates also produce relaxation of the smooth muscles. Then dysmenorrhea, painful menstruation. In this condition, again, anticholinergics are not very effective. Dicyclomine can be given, but not very effective. In this condition, NSAIDs like aspirin, ibuprofen, nimesulide, these kind of drugs are much more effective. But again, this symptomatic relief. Coming down to the problems related to the micturition, related to the urination. You remember these drugs, they retain the urine. So, if the children, they are suffering from the problem of bedwetting, they are not having the control on the urination in the night, that is enuresis. Then if there is a problem of increase in urine frequency or urine urgency, frequency and urgency there, to relieve that one. Sometimes there is a pain while urination, which is called as dysuria. It can happen if there is a urinary tract infection. So in these conditions, we can give anticholinergic agents because they relieve these spasms, they relax the urinary bladder. So those anticholinergics, they are called as vesicoselective. That means those anticholinergics which are having high selectivity for the urinary system. So what are those drugs? Oxybutynin, tolterodine, flavoxate, derifenacin, solifenacin. This solifenacin is very similar to derifenacin, but this solifenacin is a longer acting drug. So you have to remember the name of these drugs. So these drugs, they are used to overcome these problems. Again, this symptomatic management. Now in the peptic ulceration, if you talk about the therapy of the peptic ulceration, so most commonly we give the H2 receptor blocker. One of those drugs is the ranitidine, cimetidine, famotidine, number of drugs are there. Or we give proton pump inhibitors. Again, number of drugs are there. I'm just giving the one of the name, omeprazole. These are the drug of choice. Anticholinergics can be given. Amongst the anticholinergics, we prefer parasympatholytics because it selectively blocks the M1 receptors and inhibits the gastric secretions without typical side effects. But if you compare ranitidine, omeprazole and parasympatholytics, this parasympatholytics is less commonly used because they are more effective, lesser side effects in comparison to parasympatholytics. Coming down to another thing, that is a pre-anesthetic medication. What is the meaning of pre-anesthetic medication? As the name indicates, pre-anesthetic. Before giving the anesthesia medication, we are giving certain medications. Why? So that the anesthesia is smooth. No problems come in the anesthesia or the surgery. So that means there are certain medications which are given before actual administration of the anesthesia. Like we give glycopyrrolate. Amongst all the anticholinergics, glycopyrrolate is the preferred anticholinergics in the anesthesia. Reason why we give anticholinergics before anesthesia? There are 2 or 3 reasons why. It reduces or prevents what? Number 1, it prevents salivary and bronchial secretions, particularly if the anesthetic is irritant. That means you have given an irritant anesthetic and person is laying on the table and you have to perform the surgery. Because of that irritation, secretions from the mouth of the bronchi, they can accumulate and they can go into the lungs, which can be problematic condition. So you want to reduce that problem by giving the glycopyrrolate because they reduce the secretion. Again, I want to emphasize, this is particularly true if you are giving a irritant kind of the anesthetic. Second thing, because of the, sometimes there is a laryngospasm, that means spasm of the larynx, contraction of this larynx, and which can be due because of these secretions. The secretions, they can precipitate the spasm. So if secretions are reduced, spasm can also be reduced. The third thing, sometimes when you are performing the surgery and person is anesthesia, there are chances of the bradycardia, heart rate can be reduced, blood pressure can be reduced. So in order to overcome these two, so we can give the glycopyrrolate like drugs. Now next, diarrhea. It can be used in the diarrheas, but not all type of diarrheas. Diarrhea, there are many types. I will discuss in what kind of diarrheas these can be used. Like if there is a nervous, as I told earlier also, nervous dyspepsia, because when the nervous system is not is not functioning proper, it affects the GIT. So it can be manifested in the form of the indigestion, or it can be in the form of the diarrhea. So if there is a nervous diarrhea, or if it is because of some drugs, like if it is because of the neostigmine, or it can be due to the metoclopramide. Metoclopramide, it increases the GIT motility. Okay, so if because of these drugs, if diarrhea is there, then we can give the atropine like drugs. Atropine reduce the bowel motility and secretion, but they are having poor efficacy in the secretory or infective diarrhea. Very important to remember. That means if diarrhea is because of some bacterial infection, okay, so in that condition we cannot give these atropine like drugs, they are not effective. Then pulmonary embolism, not a, you can say the very important use, but sometime it can be used. Pulmonary embolism mean some clot like material start traveling in the blood, and after traveling it can go inside the lungs, in the pulmonary arteries. Okay, so when it passes into the pulmonary circulation, then that is called as pulmonary embolism. That embolism may promote pulmonary secretions. But embolism itself is a problem, but additionally it creates more problem by increasing more pulmonary secretions. So if you give atropine like drugs, they will not overcome the embolism. They are not doing anything with the embolism. But what embolism is doing additionally related to the secretions, at least we can reduce that one. So atropine will reduce the secretions which are there, excessive secretions which are there because of the embolism. But you have to give the drugs which reduce the embolism. That is a separate part. Okay. So now another use, cholinergic poisoning. If excessive cholinergic drugs they have been given, like atropine is a specific antidote. Antidote means a drug which selectively act against a poison, like anticholinesterase poisoning. What are anticholinesterase? Like organophosphate poisoning has taken place, carbamate poisoning has taken place, neostigmine, excess of neostigmine has been given, physostigmine has been given. All these are the anticholinesterase. So these anticholinesterase, they increase acetylcholine levels. So atropine will overcome their effects and will reduce the side effects. Now if there is a mushroom-like poisoning. So these were the therapeutic uses that I wanted to discuss with you. Now I am discussing the classification. All those drugs that I discussed in this today's video, I will club down into different categories. So classification. So they can be classified as natural alkaloid, that means obtained from the plants, and those which are modified one, semi-synthetic. You take the natural one and then you modify that one. Those are the semi-synthetic derivatives. Then we are having the totally synthetic derivatives. So among these the natural alkaloids, atropine, hyoscine, these are the two natural alkaloids. So hyoscine, the racemic mixture of hyoscine is more effective, L-isomer, while atropine, the racemic mixture is more effective. Okay, so racemic mixture of atropine, the L-isomer of hyoscine. Semi-synthetic derivatives. So as you can see, they are the derivatives of atropine. Atropine, methonitrate, homatropine, hyoscine butyl bromide, ipratropium bromide, tiotropium bromide. Now, actually, I just want to discuss here. If you talk about hyoscine, if you compare hyoscine and hyoscine butyl bromide, what will be the difference between these two? Hyoscine it can cross the biological membranes. So if you give hyoscine, it can cross the blood-brain barrier and it will produce the central actions also. But if you see the hyoscine butyl bromide, it is ionic in nature, so it will not produce the central actions. So if you need only. Now coming down to the another use of the synthetic derivatives is the anti-Parkinsonian drugs. The drugs are trihexyphenidyl, procyclidine, and more drugs which are vesicoselective like oxybutynin, flavoxate, tolterodine, darifenacin, and solifenacin. Now I will continue with the synthetic derivatives. Synthetic derivatives which are used as anti-secretory or antispasmodic agents like quaternary nitrogen compounds or tertiary nitrogen compounds, propenthyline, oxyphenonium, clidinium, simetropium bromide, isopropamide. Tertiary means one more glycopyrrolate. Tertiary means dicyclomine, vilethamide, and pyrazipine. So this is what I wanted to discuss with you related to the uses of anticholinergics and the classification. In the upcoming video, I will discuss the cholinergic receptors and adrenergic system. Thank you.